Hey, genuine well-wishers and ardent fans, I take it for granted that you and your beloved ones are fine and dandy. It's activist cum preacher Professor S. Suresh back with ecstasy for my 59th video in pipeline for publication on YouTube today, 10th of August 2020. Topic for discussion today is diabetes mellitus, types, causes and treatments. Diabetes mellitus is one of the lifestyle diseases. The word diabetes comes from Latin, which in turn comes from ancient Greek, which literally means a passer through a siphon. Ancient Greek physician used that word with the intended meaning excessive discharge of urine as the name of the disease. Ultimately, the word comes from the Greek diabeinin, meaning to pass through, which is composed of dia meaning through and beinin meaning to go. The word diabetes is first recorded in English in the form of diabetes in a medical text and written around 1425. The word mellitus comes from the classical Latin word mellitus, meaning melite, sweetened with honey. The Latin word comes from mel, which comes from mel, meaning honey, sweetness, pleasant thing, and the suffix itus, whose meaning is the same as that of the English suffix it. It was Thomas Willis who in 1675 added mellitus to the word diabetes as a designation for the disease when he noticed the urine of a person with diabetes had a sweet taste. Diabetes insipidus, a condition characterized by excessive thirst and excretion of large amounts of severely diluted urine, unrelated to high blood sugar levels. Nephrogenic diabetes insipidus, a form of diabetes insipidus due primarily to pathology of the kidney. Neurogenic diabetes insipidus, a lack of vapopressin production in the hypothalamus of the brain. Diabetes mellitus commonly known as diabetes is a group of metabolic disorders characterized by a high blood sugar level over a prolonged period of time. Symptoms often include frequent urination, increased thirst and increased appetite. If left untreated, diabetes can cause many complications. Acute complications can include diabetic ketoacidosis, hyperosmolar hyperglycemic state or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, damage to the nerves, damage to the eyes and cognitive impairment. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. There are three main types of diabetes mellitus. Type I diabetes results from the pancreas failure to produce enough insulin due to loss of beta cells. This form was previously referred to as insulin-dependent diabetes mellitus or juvenile diabetes. The loss of beta cells caused by autoimmune response. The cause of this autoimmune response is unknown. Type II diabetes begins with insulin resistance, a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may develop. This form was previously referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. The most common cause is a combination of excessive body weight and insufficient exercise. Gestational diabetes is the third main form and occurs when pregnant women without a previous history of diabetes develop high blood sugar levels. Type I diabetes must be managed with insulin injections. Prevention and treatment of type II diabetes involves maintaining a healthy diet, regular physical exercise, and normal body weight, and avoiding use of tobacco. Type II diabetes may be treated with medications such as insulin sensitizers with or without insulin. Control of blood pressure and maintaining proper foot and eye care are important for people with the disease. Insulin and some oral medications can cause low blood sugar. Weight loss surgery in those with obesity is sometimes an effective measure in those with type II diabetes. Gestational diabetes usually resolves after the birth of the baby. As of 2019, an estimated 463 million people had diabetes worldwide, with the type II diabetes making up about 90% of the cases. Rates are similar in women and men. Diabetes at least doubles a person's risk of early death. In 2019, diabetes resulted in approximately 4.2 million deaths. It's the seventh leading cause of death globally. The global economic cost of diabetes-related health procedure in expenditure in 2017 was estimated at US dollars 727 billion. The classic symptoms of untreated diabetes are unintended weight loss, polyuria, increased urination, polydipsia, increased thirst, and polyphagia, increased hunger. Symptoms may develop rapidly in type 1 diabetes, while they usually develop with much more slowly and may be subtle or absent in type 2 diabetes. Several other signs and symptoms can mark the onset of diabetes, although they are not specific to the disease. In addition to the known ones above, they include blurred vision, headache, fatigue, slow healing of cuts, and itchy skin. Prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in vision changes. Long-term vision loss can also be caused by diabetic retinopathy. A number of skin rashes that can occur in diabetes are collectively known as diabetic dermopathy. People may also experience episodes of diabetic ketoacidosis, a metabolic disturbance characterized by nausea, vomiting, and abdominal pain, the smell of acetone on the breath, deep breathing known as Kussmaul breathing, and in severe cases a decreased level of consciousness. A rare but equally severe possibility is hypersmolar hyperglycemic state, which is very common in type 2 diabetes and is mainly the result of dehydration. Treatment-related low blood sugar hypoglycemia is common in people with type 1 and also type 2 diabetes, depending on the medication being used. The effects can range from feelings of unease, sweating, trembling, and increased appetite in mild cases to more serious effects such as confusion, changes in behavior such as aggressiveness, seizures, unconsciousness, and rarely permanent brain damage or death in severe cases. Rapid breathing, sweating, and cold, pale skin are characteristic of low blood sugar but not definitive. Mild to moderate cases are self-treated by eating or drinking something high in sugar. Severe cases can lead to unconsciousness and must be treated with intravenous glucose and injections with glucagon. It may lead to coma, hypoglycemia, less than 50. The major long-term complications relate to damage of blood vessels. Diabetes doubles the risk of cardiovascular disease, and about 75% of deaths in people with diabetes are due to coronary artery disease. Other macrovascular diseases include stroke and peripheral artery disease. The primary complications of diabetes due to damage in small blood vessels include damage to the eyes, kidneys, and nerves. Damage to the eyes, known as diabetic retinopathy, is caused by damage to the blood vessels in the retina of the eye and can result in gradual vision loss and eventual blindness. Diabetes also increases the risk of having glaucoma, cataracts, and other eye problems. It is recommended that people with diabetes visit an eye doctor once a year. Damage to the kidneys, known as diabetic nephropathy, can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease, sometimes requiring dialysis or kidney transplantation. Damage to the nerves of the body, known as diabetic neuropathy, is the most common complication of diabetes. The symptoms can include numbness, tingling pain, and altered pain sensation, which can lead to damage to the skin. Diabetes-related foot problems may occur and may be difficult to treat, occasionally requiring amputation. Additionally, proximal diabetic neuropathy causes severe, painful muscle atrophy and weakness. There is a link between cognitive deficit and diabetes compared to those with diabetes. Those with the disease have a 1.2 to 1.5-fold greater rate of decline in cognitive function. Having diabetes, especially when on insulin, increases the risk of falls in older people. Type 1 diabetes is characterized by loss of insulin-producing beta cells. This type can be further classified as immune-mediated or idiopathic. The majority of type 1 diabetes is of the immune-mediated nature, in which the T-cell-mediated autoimmune attack leads to the loss of beta cells and thus insulin. Most affected people are otherwise healthy and of a healthy weight when onset occurs. Sensitivity and responsiveness to insulin are usually normal, especially in the early stages. Although it has been called juvenile diabetes due to the frequent onset in children, the majority of individuals living with type 1 diabetes are now adults. Brittle diabetes, also known as unstable diabetes or labile diabetes, is a term that was traditionally used to describe the dramatic and recurrent swings in glucose levels often occurring for no apparent reason in insulin-dependent diabetes. Type 1 diabetes can be accompanied by irregular and unpredictable high blood sugar levels, and the response potential for diabetic ketoacidosis or serious low blood sugar levels. Other complications include an impaired counter-regulatory response to low blood sugar, infection, gastroparesis, and endocrinopathies. Those phenomena are believed to occur no more frequently than in 1% to 2% of the persons. Type 1 is partly inherited with multiple genes, including certain HLA genotypes, known to influence the risk of diabetes. In genetically susceptible people, the onset of diabetes can be triggered by one or more environmental factors such as viral infection or diet. Several viruses have been implicated, but to date there is no stringent evidence to support this hypothesis in humans. Type 1 diabetes can occur at any age, and a significant proportion is diagnosed during adulthood. Latin autoimmune diabetes of adults is the diagnostic term applied when type 1 diabetes develops in adults. It has a slower onset than the same condition in children. Given this difference, some use the unofficial term type 1.5 diabetes for this condition. Adults with the latter are frequently initially misdiagnosed as having type 2 diabetes based on age rather than cause. Type 2 diabetes is characterized by insulin resistance, which may be combined with a relatively reduced insulin secretion. The defective responsiveness of body tissues to insulin is believed to involve the insulin receptor. Diabetes mellitus cases due to a known defect are classified separately. Type 2 is the most common type of diabetes mellitus. Many people with type 2 have evidence of pre-diabetes before meeting the criteria for type 2. The progression of pre-diabetes to over type 2 can be slowed or reversed by lifestyle changes or medications that improve insulin sensitivity or reduce the liver's glucose production. Type 2 is primarily due to lifestyle factors and genetics. Obesity, defined by a body mass index greater than 30, lack of physical activity, sedentary lifestyle, poor diet, stress, and urbanization. Excess body fat is associated with 30% of cases in people, 60 to 80% of cases in those of European and African descent, and 100% of Pima Indians and Pacific Islanders. Even those who are not obese may have a high waist to hip ratio. Dietary factors such as sugar sweetened drinks are associated with an increased risk. The type of fats in the diet is also important, with saturated fat and trans fat increasing the risk, and polyunsaturated and monounsaturated fat decreasing the risk. Eating white rice excessively may increase the risk of diabetes. Lack of physical activity increases the risk. Adverse childhood experiences, including abuse, neglect, and household difficulties, increase the likelihood of type 2 later in life by 32%. Gestational diabetes resembles type 2 in several respects, involving a combination of relatively inadequate insulin secretion and responsiveness. It occurs in about 2 to 10% of all pregnancies and may improve or disappear after delivery. It is recommended that all pregnant women get tested starting around 24 to 28 weeks gestation. It is often diagnosed in the second or third trimester because of the increase in insulin antagonist hormone levels that occurs at this time. However, after pregnancy, approximately 5 to 10% of women with the gestational diabetes are found to have another form of diabetes, most commonly type 2. Gestational diabetes is fully treatable but requires careful medical supervision throughout the pregnancy. Management may include dietary changes, blood glucose monitoring, and in some cases insulin may be required. It may be transient. Untreated gestational diabetes can change the health of a fetus or the mother. Risks to the baby include macrosomia, high birth weight, congenital heart and central nervous system abnormalities, and skeletal muscle malformations. Increased levels of insulin in a fetus blood may inhibit fetal surfactant production and cause infant respiratory disease distress syndrome. A high blood bilirubin level may result from red blood cell destruction. In severe cases, perinatal death may occur, most commonly as a result of poor placental perfusion due to vascular impairment. Labor induction may be indicated with a decreased placental function. A cesarean section may be performed if there is marked fetal distress or an increased risk of injury associated with the macrosomia. Maturity onset diabetes of the young is a rare autosomal dominant inherited form of diabetes due to one of several single gene mutations causing defects in insulin production. It is significantly less common than the three main types, constituting only 1 to 2%. People with MODY often can control it without insulin. Genetic mutations can lead to defects in beta cell function. Abnormal insulin action may also have been genetically determined in some cases. Any disease that causes extensive damage to the pancreas may lead to diabetes. Diseases associated with excessive secretion of insulin antagonistic hormones can cause diabetes. Many drugs impair insulin secretion and some toxins damage pancreatic beta cells, whereas others increase insulin resistance. The following is a list of disorders that can increase the risk of diabetes: genetic defects of beta cell function, genetic defects in insulin processing or insulin action, exocrine pancreatic defects, endocrinopathies, infections, drugs. Diabetes mellitus is characterized by recurrent or persistent high blood sugar and is diagnosed by demonstrating any one of the following: fasting plasma glucose level greater than 126 mg per deciliter, plasma glucose greater than 200 mg per 2 deciliter 2 hours after the 75 gram oral glucose load as in a glucose tolerance test. Symptoms of high blood sugar and casual plasma glucose greater than 200 mg per dl, glycated hemoglobin greater than 6.5%. A positive result in the absence of unequivocal high blood sugar should be confirmed by a repeat of any one of the above methods on a different day. It is preferable to measure fasting glucose level because of the ease of measurement and the considerable time commitment of formal glucose tolerance testing, which takes 2 hours to complete and offers no prognostic advantage over the fasting test. As per the WHO, people with fasting glucose level from 6.1 to 6.9, that is 110 to 125 milligrams per deciliter, are considered to have impaired fasting glucose. People with plasma glucose at or above 140 milligram per deciliter but not over 200 milligram per deciliter 2 hours after 75 gram oral glucose load are considered to have impaired glucose tolerance. Of these two pre-diabetic states, the later in particular is a major risk factor for progression to full-blown diabetes as well as cardiovascular diseases. The American Diabetes Association (ADA) uses a slightly different range of impaired glucose tolerance of 100 to 125 milligram per deciliter. Glycated hemoglobin is better than fasting glucose for determining risks of cardiovascular disease and death from any cause. There is no known preventive measure for type 1 diabetes. Type 2 can be prevented or delayed by maintaining a normal body weight, engaging in physical activity and eating a healthy diet. Higher levels of physical activity, more than 90 minutes per day, reduce the risk of diabetes by 28%. Dietary changes known to be effective in helping to prevent diabetes include maintaining a diet rich in whole grains and fiber and choosing good fats such as the polyunsaturated fats found in nuts, vegetable oils and fish, limiting sugary beverages and eating less red meat and other sources of saturated fat can also prevent diabetes. Tobacco smoking is also associated with an increased risk of diabetes and its complication. The relationship between type 2 diabetes and the main modifiable risk factors is similar in all regions of the world. There is growing evidence that the underlying determinants of diabetes are a reflection of the major forces driving social, economic and cultural change: globalization, urbanization, population aging and the general health policy environment. Diabetes management concentrates on keeping blood sugar levels close to normal without causing low blood sugar. This can usually be accomplished by the dietary changes, exercise, weight loss, and use of appropriate medications. Learning about the disease and actively participating in the treatment is important since complications are far less common and less severe in people who have well-managed blood sugar levels. For the American College of Physicians, the goal of treatments is an HbA1c level of 7-8%. Attention is also paid to other health problems that may accelerate the negative effects of diabetes. These include smoking, high blood pressure, metabolic syndrome, obesity, and lack of regular exercise. Specialized footwear is usually used to reduce the risk of ulcer, although evidence for the efficacy of these remains equivocal. People with diabetes can benefit from education about the disease and treatment, dietary changes, and exercise with the goal of keeping both short-term and long-term blood glucose levels within acceptable bounds. Lifestyle modifications are also recommended to control blood pressure. Weight loss can prevent progression from pre-diabetes to diabetes to type 2. No single dietary pattern is best for all people with diabetes. Healthy dietary patterns such as the Mediterranean diet, low carbohydrate diet, or DASH diet are often recommended, although evidence does not support one over the others. According to ADA, reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia. And for individuals with type 2 who can't meet the glycemic targets or where reducing anti-glycemic medications is a priority, low or very low carbohydrate diets are a very viable approach. For overweight people with type 2, any diet that achieves the weight loss is effective. Most medications used to treat diabetes act by lowering blood sugar levels through different mechanisms. There are a number of different classes of anti-diabetic medications. Type 1 diabetes requires treatment with insulin, typically with a combination of regular and NPH insulin or synthetic insulin analogs. Type 2 may also be treated with insulin at later stages. Some medications for type 2 are taken by mouth, such as metformin, while others are only administered by injections, such as GLP-1 agonists. Metformin is generally recommended as a first-line treatment for type 2, as there is good evidence that there is a decrease in mortality. It works by decreasing the liver's production of glucose. Several other groups of drugs, mostly given by mouth, may also decrease blood sugar in type 2. These include agents that increase insulin release, agents that decrease absorption of sugar from intestines, agents that inhibit the enzyme DPP4 that inactivates incretins, such as GLP-1 and GIP, agents that make the body more sensitive to insulin, and agents that increase the excretion of glucose in the urine. When insulin is used in type 2, a long-acting formulation is usually added initially while continuing oral medications. Doses of insulin are then increased until glucose targets are reached. ACE and ARBs are used. Aspirin is recommended for people at high risk of cardiovascular disease. However, routine use of aspirin has not been found to improve outcomes in uncomplicated diabetes. Aspirin is a blood thinner. Weight loss surgery in those with obesity and type 2 is often an effective measure. Many are able to maintain normal blood sugar levels with little or no medications following surgery, and long-term mortality is decreased. The body mass index cutoffs for when surgery is appropriate are not yet clear. It is recommended that this option be considered in those who are unable to get both their weight and blood sugar under control. A pancreas transplant is usually considered for people with the type 1 who have severe complication of the diabetes, including end-stage kidney disease requiring kidney transplantation. In 2017, 425 million people had diabetes worldwide, up from an estimated 382 million people in 2013, and from 108 million in 1980. Type 2 makes about 90% of the cases. But type 2 is more common in men. The WHO estimates that diabetes resulted in 1.5 million deaths in 2012. However, another 2.2 million deaths worldwide were attributable to high blood glucose and increased risk of cardiovascular disease and other associated complications. Diabetes occurs throughout the world and is more common, type 2, in more developed countries. The greatest increase in rates has, however, been seen in low and middle income countries where more than 80% of diabetic deaths occur. The fastest prevalence increase is expected to occur in Asia and Africa, where most people with diabetes will probably live in 2030. The increase in rates in developing countries follows a trend of urbanization and lifestyle changes, including increasingly sedentary lifestyles, less physically demanding work, and the global nutrition transition marked by increased intake of foods that are high energy intense but nutrient poor. Western style diet. The global number of diabetes cases might increase by 48% between 2017 and 2045. In animals also, diabetes is most commonly encountered in dogs and cats. Middle-aged animals are most commonly affected. Female dogs are twice as likely to be affected as males. Male cats are more prone than females. In both species, all breeds may be affected, but some small dog breeds are particularly likely to develop diabetes, such as miniature poodles. Feline diabetes is strikingly similar to human type 2. The Burmese breed, along with the Russian blue, Abyssinian, and Norwegian forest cat breeds, showed an increased risk of DM than other breeds. There is an association between overweight and an increased risk of feline diabetes. The symptoms may relate to fluid loss and polyuria, but the course may also include these insidious. Diabetic animals are more prone to infections also. The long-term complications recognized in humans are much rarer in animals. The principles of treatment and management of emergencies are similar to those in humans. Inhalable insulin has been developed. An advantage of inhalable insulin is that it may be more convenient in use, easy to use. Transdermal insulin in the form of a cream has been developed, and trials are being conducted on people with type 2 diabetes. Patches are also commonly used now. Oxidative stress results in diabetes. Researchers believe that nearly 30 to 50% of the people with diabetes don't even know it. It's vital for the person with diabetes to measure his blood sugar and get to know, not guess about his body. He needs to know how stress affects him, how carbs affect him, and how everything affects his blood sugar. Knowledge is power. Sometimes we find that just certain foods, just certain stresses, just certain times of the month make the diabetes work. The two major factors contributing to today's alarming rise in diabetes are poor diet and lack of exercise. In today's fast-paced culture, with its emphasis on fast foods and its de-emphasis on exercise, more and more common of us are eating unhealthy diets and choosing poor lifestyles. Our typical diet has become way out of balance. We eat too many simple sugars way too often. Most people consume candy, french fries, potato chips, ice cream, pasta, etc. on a regular basis. We eat twice the calories we need, twice the protein we need, and each year the average person consumes over 160 pounds of sugars and sweeteners we don't need at all. When you consider that so many of us are overfed and so many of us get any regular exercise, and add to that the fact that many of us overuse alcohol and nicotine, which increases oxidative stress, it is no wonder that millions of us already suffer from diabetes, are at great risk of developing diabetes in the near future. The following is a list of risk factors for diabetes: being more than 20% overweight, physical inactivity, having a first degree relative with diabetes, belonging to any of the following ethnic groups: African American, Native American, Latin American, Asian American, Pacific Islander, having an impaired fasting glucose or impaired glucose tolerance, previous blood tests, having triglycerides, blood fats which are more than 250 mg per dl, having HDL cholesterol, good cholesterol, which is less than 35 milligrams per deciliter, having history of hypertension, having history of gestational diabetes or giving birth to a baby which weighed more than 9 pounds. Diabetes complications are mainly caused by two factors: excessive glycosylation and sorbitol accumulation. Glycosylation is a process by which the sugar molecule binds irreversibly to a protein molecule. Sorbitol is a byproduct of glucose metabolism and is produced through the action of the enzyme aldose reductase. Sorbitol-induced osmotic swelling is believed to be one of the main causes of tissue damage in diabetics. This condition seems to target organs and tissues that are not dependent on insulin for the absorption of glucose. Elevations of sorbitol levels are a major problem in peripheral nerves, blood vessels, the cells of the retinal blood vessels in the lens of the eye, the pancreas, kidneys, and other organs due to the lack of insulin dependence. There are three components to a natural diabetes cure: diet, exercise, and nutritional supplement. Every diabetic should take these proven supplements: cinnamon, alpha lipoic acid, Promax, vanadium, banaba leaf, momordica, gymnema, sylvester, and fenugreek. There are other natural diabetes treatment formulas out in the marketplace today, but there is none that combines the proven efficiencies of alpha lipoic acid, Promax, and vanadium together with the excess extracts of cinnamon bark, banaba leaf, fenugreek, gymnema, sylvester, and marmordica. Many modern prescription diabetes drugs, sulfonylurea drugs, also stimulate insulin secretion from the pancreas. However, these drugs are only effective when beta cells maintain their basic function of insulin secretion. It is also reported that long-term usage of sulfonylurea drugs causes serious side effects. Long-term, they cause a decreased amount of insulin production by putting too much strain on the beta cells. Since the body eventually becomes resistant to these drugs, they lose their effectiveness and dosages will continuously need to be increased. On average, after 7 years of usage, these agents no longer work and new drugs will have to be taken. Most type 2 diabetics will then be forced to rely on insulin injections as the beta cells are too damaged to produce any insulin. Another serious side effect of sulfonylurea drugs is that they often overstimulate the pancreas and produce too much insulin. As insulin removes sugar or glucose from the bloodstream, it can result in hypoglycemia or low blood sugar. This can be more dangerous than high blood sugar, leading to shakiness, confusion, coma, and death. Other complications such as renal disease may also exist. Helpful herbs and vegetables for diabetics: bitter gourd, cinnamon, fenugreek seeds, grapefruit, seedless amla, gymnema, sylvester, Indian blackberry seeds or German seed powder, freshly crushed raw garlic, neem seeds, bale, pure turmeric powder mixed with amla juice, turmeric and gooseberry in equal quantities in powder form taken with warm water, wild jeeragam, cumin seeds, black colored, grind brahmi and add a teaspoon of it to milk and drink. By exercising, losing the extra weight, and eating the following foods, you can actually help prevent, control, or even beat diabetes in a natural way: pumpkin and ettle stew made with the peas, okra, pumpkin, carrots, chocho, and stewed down with coconut milk and served with brown rice; cherries, cinnamon and buckwheat, green tea, coconut oil, American ginseng, logwood bark, bitters, ginger, apple, beans, black pepper. Supplementation with the form of trace mineral chromium called chromium picolinate is a prudent nutritional therapy for your patients with diabetes and pre-diabetes. Diabetes is curable as well as preventable. As much as possible, resort to natural cure like exercising, eating nutritional food and herbs, stopping smoking, curtail junk food, especially Western food like burgers, French fries, pizzas, potato chips, eatables made with refined flour, and carbonated beverages. Our Indian breakfast, idli, poga, is good for the health. Debates, discussion on topics like this can go on forever. Anyhow, let me call it a day. We'll meet again real soon. Some of the statements, views expressed are solely mine based on limited knowledge gained over 6 decades. Always watch these videos with the closed captions, subtitles for absolute 100% comprehension as per my sincere recommendation. Zillion times so far. I know I rushed through to complete the presentation within 20 minutes max. This is a time limit. I had set myself to retain the viewer's attention as a norm. I know nowadays I exceed this time limit since I make honest attempts to cover the selected topic more elaborately, including so many intricate details, referring a wide variety of sources, in particular Wikipedia quite extensively, besides articles and books published recently. In addition, of course, I add my own salt and pepper and masala based on my personal experiences so far in my life and also intuition. Stay at home as much as possible to maintain social distancing attributed to pandemic novel COVID-19 and prolong your lifespan. Lead a healthy life. God alone can put a stop to unnatural events, maybe bio war, cyber war, like pandemics, which may lead to apocalypse and extinction of all sentient species on earth for no fault of theirs. All the best. Rest in peace and